Morning, everybody. Dr. Gillard here. It is week 5, spring of 2020. Here we go, another embryology lecture. So, where do we leave off? Let's back up a little bit, what we even talked about. So this is kind of where we are. We took our morula, we transformed it into an embryoblast. We got the embryoblast kind of implanted into the endometrial wall here. And the embryoblast has went through some changes. We have a blastocyst or blastocele. Blastocyst cavity has been created. We have an amniotic cavity that's been created. We have 2 layers now. This is you. This is the primitive little creature, right? We have the bilaminar disc is right here. It's made of on the top it is a hypoblast on the bottom. That's going to turn into the endoderm cells eventually. And an epiblast on the top, which will turn into the ectoderm. The 2 germ layers will make a mesoderm in between eventually. We have a cytotrophoblast layer around the outside. And then we have this weird, very aggressive, strange layer called the syncytiotrophoblast. And this is actually pulling the embryo inside the endometrium. So that's kind of where we left off. Okay, so decidual reaction we didn't get to talk about last time, but let's finish that one off. So stromal cells of the endometrial stroma, we just call them stromal cells. They begin to accumulate. They begin to swell up and collect glycogen, which is usually done by liver and muscle cells, right? But now these cells start to do it. And then fat begins to deposit. They get really fat and plump. In fact, once they get big enough, they're actually no longer called stroma cells. They're called decidual cells now. And the endometrium can be called the decidua by some authors. But yeah, so and you can imagine what those are for. So once the embryo gets in there, I mean, the thing is growing. It needs food. It doesn't have any blood yet, and we'll build a blood supply for it later in the presentation. But some of the way it gets food is through diffusion. But even then, how it doesn't have a liver, it can't store glycogen. It doesn't have a adipose tissue. It doesn't have a cutaneous layer of skin. How can it have fat? So these decidual cells give it fat and it's almost like, think of it as a liver and fat. And those are released into the environment around the embryo, and they're broken down into their components. Of course, fat is broken down into glycerol and fatty acids. Glycogen is broken down into glucose, and that diffuses into the embryo and helps kind of nourish it as it's going along. So provides nutrients, helps support growth and development. So that's an important little reaction here. The decidual cells, now this isn't well understood, and the authors are kind of all over the place on this. But there is a anti-immune function that goes on with the development of these decidual cells. And it's thought that the decidual cells release a special type of cytokine that calls in a special type of leukocyte, which secretes, amongst other things, it secretes really heavily a cytokine actually, called interleukin-2. And interleukin-2 kind of bathes the embryo, and it calls off the dog, so to speak. Because we said before, the embryo is like an invading virus, and the body is apt to kill it. We talked about one reaction for this, or one way, another mechanism. I won't go back into that, but this is yet another one. This interleukin-2, some authors think this is the most important one, but it kind of grants the embryo some immunological privilege where the immune system backs off. Mom's immune system says, okay, this is not a virus. Somehow it knows. But interleukin is 2. Carlson says interleukin-2 is one of the most important functions, or the release of interleukin-2, of the decidual reaction. Okay, Moore says, contradictingly a little bit, Moore says that the primary function of this decidual reaction is providing nutrients and to grant immunological privilege. So he just kind of covers that is the decidual reaction. So that's kind of a weird thing to say. All right, let's keep working on our little embryo. Let's build some more parts to it. It doesn't look anything like a human, right? So there's these classic two waves that come. If you're a surfer, that's like, this is a dream day, right? It's not a lot of people in the water. Oh my God, this is a great, as long as you like to go left. Maybe goofy footers love this. But there's these two waves that we talk about. The first one comes around day 9, and some of the hypoblast cells, they all of a sudden, and not all of the hypoblast cells, it seems like the ones at the caudal and cranial ends of the bilaminar disc, they undergo mitosis. And something must get soaked in. We don't know how it starts, but they start producing a new cell line. And let's say here's the bilaminar disc, here's the epiblast, here's the hypoblast. And so all of a sudden, these start spitting out new cells, and they start going downward. Because, right, we have cytotrophoblasts, we have a layer around this thing. And they start going down here, and they form a new layer. And that's called Heuser's membrane, right? So these new cells get pushed downward in line with the blastocyst cavity. There's a blastocyst cavity. This is better. But here's the cytotrophoblast, same thing I drew. And here's the cells that, for whatever reason, they go cuckoo and they start going through mitosis. And they create this new layer that lines the cytotrophoblast, or you could say it lines the blastocele. And that's Heuser's membrane. Heus, like hoist, Heuser's membrane. Some AKAs, unfortunately. Exocelamic membrane. Exocil, like cilia. Cilom, like Amish. Celamic. Exocelamic membrane is an AKA. Primary yolk sac lining. Carlson kind of calls it a strange one. No one else does. Parietal endoderm, which I don't really like that one. So I won't use parietal endoderm. And board books don't use that one. But yeah, so that's Heuser's membrane. At this point, we get a name change as well. Once Heuser's membrane lines the primary yolk sac, or once Heuser's membrane lines the blastocele. Remember, right? This is a blastocele, the blastocyst cavity. We just get another name change. It's going to change to the primary yolk sac. Primary yolk sac. That's going to turn into a secondary yolk sac in the not so distant future. Moore's, one of the chiropractic board books, gives it a really weird name, the umbilical vesicle. He's the only author that I've seen that uses that word. He goes on to say why. He says humans are not like birds, and we don't really have much yolk in there, so it's not appropriate to call it a yolk sac, even though the other board book does. So I don't really like that one, but you never know. It's fair game for chiropractic boards or for medical or physical therapy. If you guys, I don't know what board books, I'm sure you have board books as well. So check your specific book to see what your authors are calling that. But anyway, I'm calling it the primary yolk sac. So here the primary yolk sac is complete. We have a new layer, which I could have highlighted here, I guess, for you, but I didn't. But I'll do it right now. We get a new layer here, Heuser's membrane. We got a nice new cavity called primary yolk sac. And yeah, that's the deal with that. Cytotrophoblast, that name changed. Remember that used to be trophoblast and it changed to cytotrophoblast not too long ago. There's the syncytiotrophoblast. We're going to talk about these lagunae right here. What are they called? Blastocyst, cystic lagunae. Don't quote me on that. We'll get to that in a little bit. They're not filled with blood yet, but they will be pretty soon by the time we're done talking today. The extraembryonic mesoderm is the next important thing that happens. So about day 12, so we're kind of winding down week 2, a new layer begins to appear. And it appears specifically between on the inside of the cytotrophoblast and then on the outside of Heuser's membrane. Right now, those two layers are together, right? See, here they are. There's Heuser's membrane in red, cytotrophoblast. So a new layer is going to grow right between here, and it's really going to grow thick. And that new layer is going to be called the extraembryonic mesoderm. You cannot call it, you shouldn't just call it mesoderm, because we're going to have an intraembryonic mesoderm that we're going to talk an awful lot about that one as time goes by. So let's take a look at it. And here it is. Now it's quite developed. Here's Heuser's membrane right there. And here is another layer. That's the cytotrophoblast. And cells just started popping up here. Probably Heuser's membrane probably started undergoing mitosis, but we're not 100% sure where these things came from. I'll show you the confusion in a minute. Maybe cytotrophoblast cells gave rise to some of them. Some authors say a primitive streak that's going to form here, give rise to some of them up in this region. So we don't know where they come from, but they're very important because it is a mesoderm. But it's the extraembryonic mesoderm. All right, everybody good with that? There's our primary yolk stack still there. Here's the author confusion. I mean, come on, guys. You think they would have like some meeting where they all came together so it didn't make it crazy for students to try to learn this stuff. But for an example, Langman, one of the chiropractic board books, Langman. Here's more. That's the other chiropractic board book. Langman says it comes from yolk sac cells. So we don't even know what those are. So he's probably referring to Heuser's membrane cells. And he also says that some come from the primitive streak, which is a little strange because we're only in week 2 and the primitive streak doesn't form until week 3. So that's a confusing statement. The other chiropractic board book, Moore, is completely out to lunch on this. He says they're derived from vesicle endoderm. So if you Google vesicle endoderm, there's no such word in Google. I think he's meaning Heuser's membrane as well. But that needs to be fixed. And I just bought his new book, and it's still not right in that book. Then Carlson, who's my favorite book, the most referenced and the most thickest book, he's very similar to Langman. He says they come from parieto-endoderm, which is his AKA for Heuser's membrane. And then he also says they come from the primitive streak, but they don't explain how that goes, because what I'm thinking this is the end of the second week here. And you see that they haven't formed yet. They're going to form between here as well, between the amnion and the cytotrophoblast. So I have a feeling the primitive streak has something to do with that. But the primitive streak is only on the caudal end, so I'm not sure how they would form on this end. So the authors really all kind of struck out with that. Singh, he says they form from trophoblast cells. So trophoblast cells aren't even around anymore. This is just ridiculous. If he means I think he means cytotrophoblast cells, because remember we got that name changed. And then Larsen says they come from hypoblast and primary yolk sac. So yeah, that's the frustration of embryology, right? There's no one good book that tells the story. There's all these authors and they all have their ideas, and just a mess. With all this, I have taught so many subjects. This is by far the biggest mess that I've run into. The other close second place is when you get into the gastropathies, because I teach gastrointestinal pathology, and the gastropathies are also a ridiculous mess filled with AKAs. But yeah. Anyway, okay, let's stay on point. So here it is. So extraembryonic mesoderm in pink has now formed. It's made it now up here. I don't know how it's got up there because it's still in the second week, but I'm assuming, I don't know. I'm assuming it must come from the cytotrophoblast up here, but they say primitive streak, but that's not even formed yet. I'm still ranting about that. I need to let go of that. Let's focus, move ahead. But for whatever, it now completely encircles the little human, the bilaminar disc. The primary yolk sac is encircled. The amnion is encircled. Wouldn't that be a nice question? All of the following except blank, or no, how could I say that? The extraembryonic mesoderm encircles all of the following except blank. So something like that. That's one of my favorite type of questions. Here's a real human embryo at about this stage, and we can see we have a nice extraembryonic mesoderm that's formed here. And you can see the bilaminar disc quite nicely right here. Right? There's the epiblast. There's the hypoblast. There's Heuser's membrane. This author called it the parietal endoderm. This must be Carlson. Yeah, you can see all this stuff, right? Cytotrophoblast layer. It's right here. Goes all the way around. Syncytotrophoblast is like that invasive cancer. Primary yolk sac is here. So yeah, that's all the... Okay, so yep, there's where we are with that. Let's go to the next slide. So formation of the extraembryonic coelom. So what the next thing that happens, and I might have a technical problem going on, so I'm going to stop this, but I'm just doing a quick experiment here. But we'll do this. So the next thing that happens is our beautiful mesoderm gets these holes in it. And these are called the extraembryonic cavities, or the extraembryonic coelom. And they're very short-lived. They're going to start coalescing together. And pretty soon we've created a new cavity outside of the primary yolk sac. So now we have an amniotic cavity, primary yolk sac, and now we're going to have something called the chorionic cavity, or the aka extraembryonic coelom. That's pronounced Celom. Okay. Chorionic cavity, chorionic sac, Morris calls it sometimes. But yeah, so this is going to be important. And it also, I mean, it's just created two new tissues, right? Let's take a look at it more formed. It's created two new tissues for us, right? It split that mesoderm in half. So we got a new tissue here, and we got a new tissue here, and it's going to keep splitting all the way around. So we're creating, not only did we create a cavity, we've created two new tissue layers. All right, so yeah, so we got a new cavity here. And so the extraembryonic coelom, or the chorionic cavity, also, it's not going to just stay like this, as I said. It's going to keep splitting the extraembryonic mesoderm more and more. There's only one spot, this region right here. Some genes get turned on in this tissue, and it does not mess with this tissue. And this is going to be the connecting stalk, which is going to eventually be the umbilical cord. So that's the only place it doesn't split. This is going to come all the way around right up to here. But it's not going to split right there. All right, so extraembryonic coelom is advancing. Note that the primary yolk sac is also constricting as the chorionic cavity grows. This is important. We'll talk about this in a second. Notice how it's pinching. It really wants to take over this whole space. It wants to get rid of this, and it's going to get rid of that in a little bit as we go here. All right, so the two new tissues that I just showed you, they have names. The one on the outside always means somatic. The one on the inside is splanchnic. Another word, the one on the outside can be parietal. The one on the inside could be visceral, is another kind of AKA. But the chorionic cavity completely splits, and it creates two new layers. It creates a splanchnic extraembryonic mesoderm, right? Because it's the extraembryonic mesoderm that's splitting. So splanchnic is on the inside, and then on the outside it creates a new layer called the somatic extraembryonic mesoderm. A bunch of AKAs for those things. The caudal end of the bilaminar disc is the only place, as I showed you, where the chorionic cavity does not rip through, and that's going to become the connecting stalk. Let's look at some of these AKAs for splanchnic, the internal one, extraembryonic mesoderm, extraembryonic splanchnic mesoderm. That's easy to pick out. Splanchnic mesoderm. That's easy to pick out. That's not a great one, though. Splanchnopluric, some of the European texts, Seng uses this term, splanchnic pleural mesoderm. And we have visceral extraembryonic mesoderm as well, which will come later on, but that visceral means on the inside. We'll talk about visceral pleura, visceral pericardium, visceral peritoneum, all kind of come from this region, actually, as we'll see later on. But the splanchnic extraembryonic mesoderm, that's going to be inside the chorionic cavity and the amniotic cavity. It lines the outside of Heuser's membrane and the primary yolk sac. Then we have somatic is on the outside. Those are the AKAs for it. Parietal extraembryonic mesoderm is one you should also remember. It's found on the outside of the chorionic cavity and amniotic cavity, and it lines the cytotrophoblast. So let's look at pictures of this to help. So now we can name these. So this one is, here's the chorionic cavity. We'll call it the CC. The one on the outside here, outside is somatic. So this is extraembryonic mesoderm that we split. So this is just somatic extraembryonic mesoderm. I got it in a different order, but it's the same deal. The one on the inside here, inside is splanchnic, or visceral. So this will be splanchnic embryonic mesoderm. All right, and there's the chorionic cavity. So cool, we just made two new layers. All right, this new tissue will later merge with something called the intraembryonic. So we know here we have epiblast, we have hypoblast here. We're going to create another new layer of cells right in between our bilaminar disc called the mesoderm, or intraembryonic mesoderm. So these guys are going to hook up here when the time comes. All right, and that intraembryonic mesoderm will turn into a lateral plate mesoderm, and that splits into two layers. Also, it splits into a splanchnic and somatic layer as well. That's why we have to keep these names intraembryonic and extraembryonic, because there's going to be a similar type of mesoderm that's coming. Now we've just created a new tissue, haven't we? Even before we look at it, let's look what we created. So we can group this tissue right here, right? Cytotrophoblast, and then we have somatic extraembryonic mesoderm. Together, those are called the chorion. Chorion. Okay, that's important. That's going to become the placenta. We've heard that word before, so that's important. So extraembryonic somatic mesoderm now binds firmly to the cytotrophoblast, and it creates a new layer called the chorion. The chorion is the roof of the chorionic cavity. I should say cavity there. Of the chorionic cavity. Let me fix that. That's slide 263. Chorionic cavity. Sorry about that. I just put these slides in this morning, trying to tidy this up for my last YouTube video, which was before I even taught. Remember that series that's gotten pretty popular on YouTube? But that was before I taught the class even. I was just doing that because I'm was a member of that test writing committee at the Board of Chiropractic Examiners. So I thought, well, I better get smart in this stuff. And then, how strange, where the professor quit and I got the class. So that was weird. But anyway, so the chorion will encircle the secondary yolk sac and the amniotic cavity. We only have the primary yolk sac right now. That's another one I could fix. But yeah, so chorionic cavity, that's the roof. Where's the roof? So here's the chorion right here. This is the chorionic cavity developing here. So it's the roof, or it's the outermost portion of it. Right? Double-layered chorion made by cytotrophoblast layer and somatic mesoderm. I should say, I'm getting lazy. Extraembryonic somatic mesoderm, I should say. Here's the chorion again. Take a wild guess what this is called. Right here. Let's see, because we have these layers right here. Well, it's made by the amnion. So the amnion, no, that's still chorion. Yeah, sorry about that. All right, anyway. All right, formation of the secondary yolk sac. So let's make a new yolk sac. So remember we had our beautiful waves coming in here for goofy footers. Yeah, let's talk about this. So the wave and pinch. I talked about the pinch a little bit, but the second wave of new cells is going to happen from that same region. Those same hypoblast cells that made the Heuser's membrane, they're going to go through mitosis again and start spitting out yet another layer. It's almost like they're going to cover up Heuser's membrane. But they don't make it that far this time. They only make it about halfway down because that chorionic cavity is growing like crazy and it's pinching it. Why don't they make it all the way? Because the chorionic cavity is being pinched inward by the expanding chorionic cavity. I mean, the primary yolk sac is being pinched by the expanding chorionic cavity. So the cells only end up lining half of a new cavity. And we're going to call that the secondary yolk sac, because the primary yolk sac is basically cut in half by this expanding chorionic cavity. Okay. Meet the secondary yolk sac. Once the chorionic cavity completely pinches off everything I just said, we have a new yolk sac. It was the old primary, but let's give it a new name. Give it a new name called the secondary yolk sac. Langman again goes out and calls it something weird, definitive yolk sac. Definitive yolk sac. He uses that throughout the book, so watch out for that one. For the other authors just call it secondary yolk sac. All right, so here's where we were. The chorionic cavity is growing. It's growing this way too. Remember, it's going to come around like this, but it's not going to touch, not going to touch this region here. That's going to become yolk sac. But it's pinching this primary yolk sac almost in half here. But here's the new cells. Hypoblast cells are undergoing mitosis, and they're spitting a new cell layer out on top of Heuser's membrane. This layer actually never gets a name, which is strange, because there's Heuser's membrane right here below this. So this pinching occurs, and it literally pinches the primary yolk sac in half. And therefore, this is just going to degenerate away. That kind of, here's the AB embryonic pole down here. This piece toward the AB embryonic pole is going to just degenerate away, as we'll see. Here's the next kind of step. And you can see, yeah, it's almost completely gone, but we have a new space created, and that's called the secondary yolk sac, and it's lined with not Heuser's membrane anymore. It's lined by this new unnamed layer, which is really strange. Some people just call it yolk sac cells at this point. They name everything. You think they would name this new layer, but they don't. So extraembryonic splanchnic disintegrates. So, right, because this was splanchnic mesoderm right here, right? That used to go down like that. Well, it's gone. It's almost gone. It'll be gone in a second. So that gets destroyed, degenerates away. And also notice the chorionic cavity is taking over that whole area. So here's what we have now. Remember I said it wants to take over, and it does. So pretty soon it's going to almost completely surround the growing embryo and the secondary yolk sac. There's the remnant, what's left of the primary yolk sac right there. So this is our embryo now. Right? We haven't even hit week 3, but we're probably on the last day of week 2. We're almost there. Secondary yolk sac, or the definitive yolk sac, remains a major structure associated with the growing embryo. Some authors forget about the proper naming of it, and they don't call it a secondary yolk sac. They just call it the yolk sac from this point on, which is confusing for students to learn things if you're not consistent. And it, besides protective function and maybe a tiny bit of nourishment, it is a place for hematopoiesis later on in development. Not the first hematopoiesis we'll actually talk about today. It's lined with something. What was that new cell layer called? So the first and secondary primary yolk sac layers came from the hypoblast. So Langman says, well, let's just name collectively that Heuser's membrane and this new layer that came down. He just calls it endoderm, which you really shouldn't do, because we're going to talk about endoderm, and endoderm occurs through gastrulation. So this is I don't agree with doing this. It's so confusing for the students because we haven't come to forming. Endoderm is one of the 3 germ layers. It's a super powerful stem cell. So why confuse students like this, Langman? But I wanted to warn you, because chiropractic board books, somebody might throw it on there, which I hope they don't. All right, let's talk about the allantois. So the last day of week 2 we're still talking about. Notice how the chorionic cavity has cut everything out except this yolk, or this connecting stalk. That's going to become the umbilical cord. But about day 13, we start to get a little diverticulum right there. And that is going to eventually turn into, cells from it are going to make a urinary bladder. So that's kind of our first kind of primitive urinary bladder things. That makes a urachus, which we'll talk about in a second here. Okay, so day 13, chorionic cavity splits except for one region, the connecting stalk. We talked about that. Oh, I guess I kind of jumped the gun on that. Urachus. The connecting, this is a great question. Connecting stalk is said to suspend all of the following structures except blank. There's the question. But it suspends the following structures within the chorionic cavity. So we have the amniotic cavity. Let's see if that's true. Yeah, so here's the connecting stalk. So if this is the stalk and this is the apple, what hangs from the stalk? All this stuff does. The amniotic cavity does. The bilaminar disc does. The secondary yolk sac does. I guess you could even say the splanchnic extraembryonic mesoderm does. Right? Okay, so there's all this stuff. Could have said secondary. I could have said splanchnic extraembryonic mesoderm too. Could have added that in there. Forms the future umbilical cord. Now the allantois. So now we're kind of starting to get into week 3 stuff, are we? Week 1 is to 7 to 14. Yeah, we're starting to get into week 3 stuff, but threw it in there anyway. I guess I could have threw it later. But on day 16, we do get a diverticulum forming in the dorsal caudal wall of the secondary yolk sac, and it kind of grows into a diverticulum is an inpouching or an outpouching of a tube. The diverticulum has to have a tube as well. And so that's called the allantois. It'll eventually connect all the way up to the undersurface of the belly button, and a cloacal membrane is forming about the same time. I should probably move these slides to right after the cloacal membrane, which I'll probably do next time because we're still in week 2. But there it is. So, and by this time, I think we would have the primitive streak starting to form right there. But there it is, the allantois. In humans, it's vesidual. It doesn't really do that much other than induce the formation of the urinary bladder. I guess that's important. But I mean, the tube doesn't really work. No urine, because we're making a bladder. No urine comes out of the bladder and goes into the umbilical area. Like in some species, it does. It's filled with urine, and it goes into the mom, and she takes care of it. But it's vesidual in humans. In other species, it removes urinary waste. It has, in birds, it has a respiratory function as well, kind of like rudimentary lungs. We have a placenta to take care of all that stuff in humans. But it does give rise to some important structures, induces the urinary bladder, and some of the veins in the area will come from this area as well. Some of the arteries and veins of the umbilical cord are formed from this. So it does do some things. Proximal port after the bladder will become the urachus. You'll actually see that in gross 2 anatomy if we're back in class. Hopefully we will be eventually. And you can see that after birth, the urachus dries up into a fibrous cord called the median, not medial. There's a medial umbilical ligament, 2 of those. But it becomes the median umbilical ligament because it's right in the median sagittal plane. Here's a posterior to anterior view. But it's looking at a coronal cut. Here's the umbilical. So if you're Ant-Man, if you're standing inside or floating around the peritoneal cavity, and you're looking outward, there's the backside of the belly button, the umbilical plate, which is important for hernias. But here's this extension of tissue that's dried up. So that's now called the median umbilical ligament. And then we have these medial umbilical ligament. So median, medial, there's 2 of those, which are actually, they transmit some blood here. So there's a medial umbilical artery, which is really weird. It dead ends and turns into a ligament. So you'll see this in gross 2, what a strange structure this is. All right. Hooking up the blood supply. Okay, this was kind of a tough story to get, but I just completely redid this, so this will be a little different than last quarter and different from the other embryology videos that are on YouTube. So hooking up the blood supply. So we need to go back. We still are in week 2. Well, I guess we jumped a little ahead to week 3 for the urachus, but now we're back in 2. So even before implantation occurs, or is completed, I shouldn't say occurs. Did I say that? I should say completed. So let me make a note to change that. I don't even know what slide that is. Looks like 283. Completed. So even before implantation completed, the syncytiotrophoblasts develops these little cavities in them. And they don't do anything yet, but they have a name. They're called lacunae or trophoblastic lacunae. Why they don't call them syncytiotrophoblastic lacunae, which they should call them, I don't know. Maybe it's just too confusing because they do occur. They don't occur in the trophoblast or cytotrophoblast. But nevertheless, that's what they're called. And so the syncytiotrophoblasts will actually grow into mom's endothelial capillaries. So here's endothelial capillaries, endothelial glands there, endothelial capillaries. So these guys are going to hook up. And we're going to fill these with blood, which isn't going to do a whole lot, but it's going to make the syncytiotrophoblasts full of blood. But we don't have any way to get it into here yet, to the growing human, the little human. But that's kind of where we're going with this. So it does establish a crude circulation, but it's not going to do any good. The syncytiotrophoblasts are going to be really happy because it's going to get nutrients and oxygen. It's going to be super happy. But it doesn't get into the disc, the little human, so we got to fix that. So the embryo next grows its own circulatory system. And here's just the lacunae hooking up with these blood vessels of mom, placental blood vessels, capillaries. Remember, we're super small. These are capillaries. Remember, this whole picture is about the head of a pin here. That's a pretty big head of a pin. So this is all really tiny stuff going on. And so this whole area will be filled with blood. Right? But now, so we got the trophoblast, cytotrophoblast layer. We need to get blood into the little growing creature. And so that's our next step to grow our own circulatory system. So meet the primary chorionic villi. At the end of the second week again, maybe starting the third, we're at that gray zone. The chorion grows some little spikes, and they stab into the syncytotrophoblast, which now has blood, right? Its lacunae are now filled with mom's blood, so we can tap those, and that's what's happening next. So chorion grows out to tap those, and these little points are called primary villi. Primary villi. So you can see one growing right here. See? So cytotrophoblast, but so is the extraembryonic somatic mesoderm. So remember, together those two are called the chorion. That's why primary chorionic villi are made up of really the chorion. All right, got that? Now be careful with that type of board question. Primary chorionic villi, they're made up of technically cytotrophoblast, is in green, and this extraembryonic somatic mesoderm as well. So you could say that, or together they're called chorion. See, there's different ways you can word that question, so be careful with that type of a question. But nevertheless, they're surrounded now. They've poked themselves into that lacunae, and they're surrounded by blood. Okay, so now what happens next is we get a new cell transfer. We won't get into the details because they don't understand it, but the cells, new cells will start to form inside here, and they're going to be mesenchymal cells, which are like stem cells. They're a little bit pre-programmed, but they're magical. They're stem cell-like. They're mobile. They can move and travel. And so, so the primary chorionic villi gets filled with a mesenchymal tissue. And once that mesenchymal tissue shows up in the primary chorionic villi, it changes names into the secondary chorionic villi. What's the difference between a primary and a secondary chorionic villi? The presence of a mesenchymal tissue, and that changes the name. Right? So here's mesenchyme that's now formed in these primary villi, and so we can't call them. The screen is all magical tissue. And so we can't call them primary villi. Now we got to call them secondary villi. Secondary left chorionic villi. Can make a note to fix that too. 292. Secondary chorionic villi. Are we good? So that mesenchymal tissue, we can morph. Guess what we're going to morph that into? Take a wild guess. Blood vessels. How about a capillary system? How about arterioles? How about small veins and arteries? I'll go a step further. We're going to morph this into blood cells, white blood cells, red blood cells, and platelets. So the baby's going to make his first blood vessels, blood cells right here, and they're going to, really quickly, they're going to get into mom's blood. Hopefully she doesn't have a reaction to these type of cells. Some moms do. I won't go down that road, though. It's too early for talk about hematology. But mesenchymal differentiation, so mesenchyme in the secondary chorionic villi, in order to accomplish our goal of making blood vessels and blood cells, we have to undergo a new process. And the process is called vasculogenesis. So the mesenchymal tissue will morph into these red blood cells. So the first thing that happens is we have to turn on some genes in that mesenchymal tissue. And fibroblast growth factor 2, FGF2, is actually expressed in the chorion cells. And that binds and soaks into the mesenchymal cells and makes them turn into a new type of tissue called a hemangioblast. So mesenchyme gets bombarded with FGF2 and it morphs into hemangioblast tissue. It's still stem cell-like, but hemangioblasts can morph into either blood cells, or it can morph into arterioles, venules, capillaries, even small arteries and veins. So that's what it can do. And that's what it does do. But it needs a little help, because right now we have FGF2 converted mesenchyme into hemangioblast. Its job is over, but now we need to morph them into here. And this is where our next factor comes from it. And this is called vascular endothelial growth factor. So genes from that same, probably from the chorion again, they soak into the new hemoblast tissue, and they turn on new genes. And they turn on genes to make it turn into a tube, and that is going to form the microcirculation. They also, some of the tissue, some of the hemangioblasts get affected a little differently. There's another factor that they think they're missing because it can't do the same thing. But we know if you take hemangioblasts away, you can't make the blood cells either. If you take VEGF away, you can't make blood cells. You need VEGF to make both blood cells and the microcirculation, the tubes themselves. So some hemangioblasts get genes turned on, it causes them to morph into the first blood cells. We think VEGF and another unidentified gene product from somewhere is responsible for making them turn into blood cells. All right? But the fledgling, so now we have fledgling blood vessels. They're given a name because that story's not quite done. They're called blood islands. And they're meaning mesenchymal blood islands. They morph into these endothelial cells. I guess I could probably take that out, right? Just leave it at the story the way I described it. Should I take out the blood islands? I'll leave them in there just in case, but that's just a step. The blood islands will morph into endothelial. Oh, I see what I'm saying. So yeah, that is another step. Because we formed the tube so far, but we haven't really formed the endothelial cells that line the tube. And to form the endothelial layer, we get a morphing of the blood islands into endothelial cells. I think that's getting a little complicated now, don't you? But here's a chorion. Okay, so genes are turned on in the chorion, and they express over here. They express FGF2, and they bind to just the mesodermal cells, and they convert it into hemangioblasts. Right. So this, I would have drawn this more together, because that's what they do. And then we have FEGF come down, and it binds to some of these cells. Some of these cells that get experience or get bound to or soak up VEGF, they kind of move to the periphery, and they create a tube-like structure. And that's turned into endothelium. I don't think that's important to go that far. But the FEGF also binds to some of these other cells, and they don't become a tube. They flat out turn into blood vessels. And I guess there's something with a different receptor they bind to, but I'm not going to get that crazy deep. So just know that chorion secretes FGF2, and that binds to the mesenchymal cells, and that turns them into a mass of hemangioblasts. Hemangioblasts can go two ways. When VEGF comes in and binds to certain receptors, some of them stick to the outside and become the actual blood vessels of the microcirculation. Other ones, VEGF binds and causes blood cell development out of that same hemangioblast. Bottom line, hemangioblasts can turn into the endothelial cells, the actual pipes, or they can turn into the blood cells, the red blood cells, white blood cells, and platelets of the first fetal blood system, I guess. And those will, as you can imagine now, once these real blood vessels are formed, they secondary. Once we start forming some blood vessels, we can't call them secondary anymore. Now they become tertiary chronic villi. So which type of villi have a microcirculation and blood cells in it? Primary, secondary, tertiary. Tertiary do, of course. Secondary don't have any blood vessels formed yet. What do secondary have in them? They have hemangioblasts in them. See how the way it works? And now the tertiary cells, villi, are going to grow a little more, and they're going to tap into the trophoblastic lacunae in the syncytiotrophoblastic, and bam, the embryo has its first rudimentary circulation, and it even has its own blood cells that most mothers don't know, but some mothers do, because they can have an allergic reaction to them, which is always a terrible. That's why pregnant mothers are always tested for Rh, right? Look for those rare types of Rh where the baby might not be the same type, and then you got a big problem. But anyway, here, vasculogenesis, via vasculogenesis, the rudimentary circulation spreads down. So here's our primary villi. Our microcirculation has extended down the connecting stalk, and it's actually supplying the embryonic disc, and it's all folding, so we're in week 4 now. This folding has occurred. So now we're way in the future. But it's extended around the yolk sac, the primary or secondary yolk sac, and yeah, so now we have a little circulatory system made. Okay, that circulatory system has collectively a name, and that's called the uteroplacental circulation. All right, so blood is flowing in cells around the bilaminar disc, everything I just said. And the new system is called the primordial uteroplacental circulation. Okay, so we are done with the week of 2s. This is the end of this lecture. The week of 2s, the second week is called the week of 2s because so many double things happen. Let's go over those. So the trophoblast, remember that split into, those cells started going through mitosis, and they gave rise to the syncytiotrophoblast, which helped pull the embryo in to the endometrial wall. And once syncytiotrophoblast, we renamed the trophoblast into a cytotrophoblast. The trophoblast is still there; it's just really an AK for it, but we renamed it. The inner cell mass, we watched that differentiate in from a one-celled structure of cells into a bilaminar disc, and that made up of an epiblast and hypoblast. So that's 2 things. The extraembryonic mesoderm that formed so nicely was split by the chorionic cavity, and it split into a extraembryonic somatic mesoderm and an extraembryonic splanchnic mesoderm. Larsen likes to call it the somatic parietal layer. There's your parietal and visceral AKAs. 2 cavities have formed. We had an amniotic cavity, and now we've had a primary yolk sac, really 3 cavities, though that turned into a secondary yolk sac. We talked about the 2 waves that came down from the hypoblast mitosis. Cells of the hypoblast undergo mitosis in 2 waves. First wave forms Heuser's membrane. Second wave comes down and forms just the secondary yolk sac wall, I guess. For whatever reason, again, it's not named. All right, so I think that is enough for our brains. We're going to start a really important week, week 3, is gastrulation. We'll start that next week on week 6. Actually, we won't start that on week 6. On week 6, we have our first test, and it's going to be an online test. And so it will obviously be open note, but it's going to be time locked, so make sure you know your stuff. You can't go into this test without studying because you won't be able to get through your notes before the test locks out. So make sure you study. All right, see you in the next video.